Good afternoon. It is Thursday, June the 10th, 2021. Sego, David Lahashu Juts. Welcome to another edition of the COVID-19 Task Force Update on this, our 215th edition of Kahnawà 911. We don't have a very long show for you today, but we do have a very informative one and a very important one. So if you're out there, please pay attention. Lisa Westaway, the Executive Director of the KMHC, will be here to provide you with some very important information and updates on our vaccination campaign. So we'll start right off with Lisa. Lisa.
Thank you very much. So nice to see you. It's been a little while, or it feels like it's been a long time. So just some news to give to you and some updates. First of all, regarding statistics. So as you know, this week, next week, the week after, so for 3 weeks straight, we're in the middle of our vaccination campaign for second doses. So we will be vaccinating approximately 3,300 people with second doses of Moderna. But as that's happening, as of yesterday, end of the day, I do have stats available to provide to you. So I'll start with that. So first doses for 18 plus, we're now at 76% vaccination rate in Kahnawà. For second doses, we're at 21%. And as I just mentioned, those numbers are increasing daily. And we hope to reach that 76% by the end of the 3 weeks. A quick note before I move on to the rest of the stats. As you know, we have been, over the past 2 weeks, canceling and rescheduling second dose appointments for 18 plus, for people who are over 18 who receive Moderna as a first dose, because we have received our Moderna doses earlier than expected, thankfully, and therefore we are booking appointments earlier than the appointments that were originally scheduled in July and August. So if you have not received your rescheduled appointment, then we ask that you call KMHC at extension 2295 and we will book your second dose appointment. So it's possible that you did not receive a phone call. There were some glitches in the system, or some of you were called at the end of the day to book your original appointment, and therefore you were, there's a few little mix-ups that have happened. Some of you have also received several cancellation notices. This was an issue with Click Santé. So no matter what the situation, if you need to book your second dose appointment, we urge you to call extension 2295 to make your appointment for your second dose. And to check your emails or text messages to look at when your appointment has been scheduled. The team, all of the administrative team at the bingo hall are doing a great job. If somebody doesn't show up for their appointment, they call, they reschedule, they make sure that that we find a way to get you vaccinated with your second dose, no matter the situation. So we really ask that you be patient. We're really working hard to organize all the logistics around this. But as I said, 76% 18 plus are booked, have had their first dose, and 21% have had their second dose, and we are going to continue to vaccinate over the course of the next few weeks. Extension 2295 to make your appointment. 16 and 17-year-olds. So these numbers also continue to rise. We had Pfizer vaccine in Kahnawà last week. We still have some Pfizer vaccine left here for vaccinations for 16 and 17-year-olds or 12 to 15-year-olds. So 16 and 17-year-olds first doses, we are now at 77%. That's a huge increase. After our first vaccines several weeks ago, we were at 60%, so we've gone up to 77%. That means that you are coming in, you're getting vaccinated. This is great news. Second doses for 16 to 17-year-olds are at 8%. This is normal because we haven't yet reached that 8-week interval for the 16, 17-year-olds, or we've just reached it. So on the 14th of June, which is Monday, we are having a walk-in for Pfizer. So remember, this is for Pfizer second doses for 16, 17-year-olds or first doses for 12 to 15-year-olds. And you can walk in without an appointment on Monday I believe starting at 9 o'clock, but I just have to double check that on the release, but I believe it's 9 o'clock until 3:30. So first doses for 12 to 15-year-olds, second doses for 16 or 17-year-olds who received their first dose in April. Anybody who received their first dose in the last week, please don't come in for your second dose. It's way too soon. I'm giving a lot of information, so I hope it's not too confusing, but all of this has already been released in official communiques, so all you have to do is go to the Kahnawake 911 website to look at recent communique releases, and you will have all of this information that I'm just simply repeating for you today. So we'll look at stats for 12 to 15-year-olds. This is the category where we've had the least response up till now, and we're at 51% of our 12 to 15-year-olds. This is not unexpected. There's been some issues with our families and parents knowing that we vaccinated 12 to 15-year-olds last week. So that's why we're having the walk-in day on Monday, the 14th. Oh, sorry. Okay, so the 14th is 1 to 6. That's true. We made it later so that parents can come after work if that's what they need to do. So don't show up at 9 o'clock. I'm sorry. That's my mistake. It's 1 to 6 on Monday the 14th. So 51% are vaccinated with their first dose, 12 to 15-year-olds. It's expected because people didn't know. We've heard about our vaccination that was taking place. And so this is really important that we get the news out there about the walk-in on Monday the 14th. There will be an ad, there's also an ad going out in the newspaper this weekend. We also are very well aware that many of the schools outside of Kahnawake are organizing their own vaccination campaign for their students. So they're either busing their students to vaccination sites in the Montreal area, or they're organizing different ways for their students to be vaccinated. So it's possible that many of our Kahnawake children will be vaccinated at their school. If that's the case, it would be wonderful if you could let us know at extension 2295 so we can add you into our stats. Otherwise, I am hoping that we can consider a percentage vaccinated from the schools, but we'll do a census, I guess, once this is over, so that we have a good idea of who in the community is vaccinated. And of course, our 12 to 15-year-olds have not received their second dose yet. So why should 12 to 17-year-olds be vaccinated? We talked a lot about return to school. There has been a lot of communication in the general media about the fact that if 75% of 12 to 17-year-olds are vaccinated by September with 2 doses, that there will be no measures required for return to school. So no masking, no distancing. Of course, hygiene is a new, something new that we've implemented that I think will be maintained forever. But it would be nice to know that our students can return safely to school. Our families will be safe. Our elders will be safe if we have high vaccination rates for that age group. So we really urge you to think about vaccination. One other element that we know has been difficult for families to be able to make a decision about whether they should vaccinate the 12 to 15-year-olds or not is lack of information. So although our website has information about safety and protocols, and a lot of the research has demonstrated that these vaccines are safe for that age group, we want to remind you that we have offered the phone number of our nurses, and you can call at 2213 to speak to our nurses and ask all of your medical questions regarding vaccination for that age group. So please don't be shy to use that what we've put at your disposal. And we did do something similar for the 18+ category, and it proved to be very helpful. We're also considering future Zoom for parents of 12 to 15-year-olds, and we'll give you more information about that if we move forward, if we feel that it could be helpful in the coming week or so. So not just return to school is important for this age group, but having our adults vaccinated does not necessarily protect the whole community. So the more people who are vaccinated, the better for get-togethers, for you know, being able to be with our friends again, for socializing, for activities. We also know and are hearing a lot of information about the possibility of upcoming opening of the border, and there may be different rules for those who are vaccinated versus those who aren't. So we're giving you this information. We are not forcing anybody to be vaccinated. We want to make sure that you have the information to be able to make an informed decision, and the one that's best for you and your family. Of course, if you choose to not be vaccinated, that's your personal choice, and we're okay with that. However, being vaccinated has demonstrated quite well that we eliminate the risk of severe illness and death, and therefore, if you are vaccinated, you do reduce that risk greatly for yourselves. For children, we know that they very rarely had a severe illness and death. However, there have been cases of medical issues over time for children who do contract COVID that we would want to eliminate through vaccination. People who are fully vaccinated also greatly reduce the risk of transmitting COVID-19 to a loved one, to a family member. And one thing that's really important to note that has changed in the last week or so is isolation measures. So many of you are saying, why should I be vaccinated? I'm still wearing a mask, nothing's changed. Well, in fact, that's not true. So people, when we have higher rates of 2 doses, so fully vaccinated individuals, masking requirements will change. However, what has already changed is isolation requirements. So if you are fully vaccinated and you've been in contact with a positive case, you will no longer have to self-isolate for 14 days. You will only have to self-monitor for symptoms. So this is huge, and another reason why vaccination is really important. So I think that's most of the information that we wanted to give. We know that the border rules are going to change for people who are fully vaccinated, not requiring tests prior to travel, not requiring tests upon return, not requiring isolation as well. So travel will be much facilitated. And of course, what the private businesses do, like the airlines and the different countries that are receiving tourists, how they might organize their rules, we're still not sure of, but we know that some cruise lines are enforcing that to book travel with them. You have to be fully vaccinated. So we'll keep you posted about that as we get more information, but it's useful for you to do that research so that you are aware when you're making decisions about whether you should be vaccinated or not, whether these things are important to you. Travel may not be a value in your life and therefore not necessarily a determining factor about whether you get vaccinated or not. And again, this is just information so that you can make those informed decisions for yourself. I just want to move on a little bit to our measures. So as you know, we're in the second phase of reopening, and again, things are going really well in the community. We know that people are making informed decisions about how they might want to have their personal gatherings while respecting measures, or if they want to go into a restaurant with another couple or another household, as these things are now allowed. And on the 18th, Friday the 18th, we do expect to move into phase 3 of our reopening plan. So again, if you want to see what that means, you can look at the Kahnawà 911 site, which may lead you to KMHC's site, and you'll see our reopening plan. It is there, and it's really well laid out by our communications team. So we expect, and if everything stays on track as it is now, we have 0 active active cases. We do still test at the testing site, but very few people are coming in. We hope that if you have symptoms, you do come in to be tested, but we expect to move into phase 3 on the 18th. This is going to coincide very closely with Quebec's move to yellow. And so just a little advance notice that we expect to move into our yellow, downgrade into a yellow risk level also on the 18th as we move into phase 3. And basically that is just an indication to the community that our risk level has decreased significantly for contracting COVID, and that really is because of our vaccination rates and our clear following of infection prevention and control measures and all of the COVID-related measures that we've put in place in the community. So again, we thank you for that, because it's really allowing us to move forward with a reopening plan. What it also coincides with is the upcoming end to our state of emergency, and that is expected to happen on the 21st of June, where we automatically will transfer into a recovery phase. And in the coming weeks, we'll speak, couple of weeks, or probably next week, we'll speak to you a lot more about what that means, what a recovery phase will look like, and how that might impact you in the community. But really it is a state of monitoring where we will end directives and maybe put some new, less imposing directives in place as we head towards a green state and an end really of the COVID-19 pandemic within the community. So again, throughout the summer we'll be moving towards these decreased measures, and we hope that things continue to move in the direction that they're moving so that we can do so. All of us, I think, are happy to return to that new state of normal. However, what we do suggest is that you start to think about what it is you learned during COVID that might benefit you to maintain in the future. So remember, COVID forced us to slow down, spend more time at home with our families, really focus on what's important to us, what do we value in our lives. So this is a great opportunity to really reflect on all of the things we've gained during COVID, not just the things we've lost, but what have we gained as individuals, as a community, what have we gone back to in our culture, so that we can keep those things in our lives as we move forward. So we really urge you to start focusing on some of those things before we get caught up in the hustle and bustle of life and go back to kind of where we were before. There are some really good positives that we've gained over the course of the last year and a half. I should end on that note, but I did just remember something that I wanted to talk about, especially with respect to daycare and some of the young children who are not having the opportunity to be vaccinated and still are following some pretty strict measures regarding staying home when you have the sniffles or a runny nose. So just a reminder that runny nose is part of the A category of COVID-related symptoms, meaning it is, if you have just a runny nose, it could be an indication of COVID, and therefore our daycares still require you, your children, to stay home when they have a runny nose. And this has been really difficult for families, I know, really difficult for the daycares as well. But one thing that can solve an issue is to really evaluate if your children have allergies. So allergies are really bad this year. I can attest to that. I take an allergy pill every day, but I think that many children seem to be impacted by allergies this year more than ever, including my granddaughter, who has been home and tested on several occasions, but we really have identified that she has allergies. So if that is the case for you or your children, we really urge you to consult with the pharmacy. This is covered by health plans. You don't have to pay for allergy medication. Consult with your pharmacist and give your children allergy medication daily, which will avoid them having allergy symptoms, and therefore avoid the mix-up between allergies and potentially COVID. So taking allergy medication will get rid of allergy symptoms, but it won't diminish COVID symptoms. So if you're taking allergy medication and you still have a cold or a runny nose, you're still going to have to be out of daycare. However, if you're taking your allergy medication, it may just save you a few days off of work. So it might save you a little bit of time, and it might be easier for your family. So that's it for today, a really quick show. But again, we urge you to come and be vaccinated, or to call if you have questions so that we can answer them from a medical perspective. And we thank you again for really making this reopening plan very successful up till now. Thanks.
Thank you very much, Lisa. Very informative for sure. Again, if you need any information about COVID, vaccination, Kahnawà's opening plan, always visit www.kahnawake911.com. The page is full of information. All you have to do is read it. Just a small programming note for next week. We'll be Facebook Live with Kahnawake 911 on Wednesday afternoon instead of Thursday. Small little programming note there, so tune in on Wednesday. And that's it for today's edition of Kahnawake 911. From all of us here, Yawagoa, Danu, Onagiwahi.